I'm sitting here today with Matthew, and Matthew, you're in from Hawaii, and we treated you about 3.5 years ago. You were having quite a lot of low back pain that we determined was from dehydrated discs. We did a stem cell treatment, injected your lumbar discs. Tell me a little bit about what your pain was like before we did the treatment, and then how you've been these last 3.5 years.
Yeah, so just to follow up, wasn't only my lumbar disc, but my other main issue was a torn meniscus
Mm-hmm.
in my knee. So I was at a point where I couldn't bend down and stand up, like without having 5 minutes of me kind of trying to walk it off. You know, first my knee went bad, then my back went bad, thinking that I'm not lifting things correctly. So it went from me not being able to surf, barely being able to produce and provide for my family, to coming up here, getting the treatments done in December 2017. I went home, did a series of physical therapy myself, taking it slow, adding like bicycling, weights, going swimming again. Within 4 months, I went on a surf trip in April for 6 weeks, and pretty much I probably overdid it, having so much fun. Got a Baker cyst in the back of my knee that cleared up, but since then I've been able to surf, stretch, go to work every day. I've been putting in the last 3 years probably 18 hours a day, 7 days a week, probably abusing my body a little bit more than I should have.
With farm work.
Yeah, with farm work, a lot of lifting, a lot of running crews. I mean, sometimes during seasonal changes, I might work a day and a half straight without even sleeping. So, not paying attention to myself, I probably got myself back into this type of position that I'm in. So, this time around, I'm going to take my recovery more seriously and not being able to put as much work, stress on myself. But given that, I was very happy with the procedure that was given to me. It got to get my surfing back, which is very helpful to me,
Mm-hmm.
personal wise. And I was able to work and provide for my family these last 3 years, which is very critical.
That's great.
Yeah.
That's great. And we're going to do a touch-up treatment on you, and you brought me your dad and your wife. We're going to do the whole family.
Yeah.
Super. All right. Well, I'm so glad for you, and let's do a treatment today and get you 6 years.
All right.
Sounds good.
Sounds good.